And I'm sorry, but do I introduce myself?
No, I'll introduce myself. So just letting
Yes,
people to join.
Just a quick note, I did not have the interpreter menu pop up. Could you just check that?
Very good. Hello, everyone. Just give us one moment so we can organize. So I will talk a little bit slowly to allow people to join. Good morning, good afternoon, and good evening. Welcome, everyone, to the Stanford Ukrainian project. As you all know, we've been doing these webinars for over a year now, and they tackle different topics related to pediatric mental health. But recently we have focused on topics related to children with autism or individual with autism. I will do the introduction of Dr. Hendren in just a few minutes, but first some housekeeping items. If you have any questions, please use the Q&A function. Using the chat will not allow us to see the questions. You can put your questions in English, Ukrainian, or Russian, and they will be translated. And I want to take this opportunity to thank Irena, who will be translating or interpreting from Russian to from English to Russian, and Dimitri, who will be interpreting from English to Ukrainian. And I want to acknowledge Ali, Dana, and Dario, who has been helping us out today. My name is Antonio Harden. I'm the Director of Child Psychiatry Division here at Stanford, and it's my privilege to introduce Dr. Bob Hendren, who will be doing a presentation today on advanced psychopharmacology and complementary alternative treatment in ASD. Dr. Hendren is a professor of psychiatry and behavioral sciences in the Division of Child and Adolescent Psychiatry at University of California, San Francisco. He's the co-director of the UCSF Dyslexia Center and the director of the program for research on neurodevelopmental translational outcome. I like the name, Pronto. Dr. Hendren is the past president of the American Academy of Child and Adolescent Psychiatry, and he has published well over 150 scientific papers and 5 books, and has been listed in the best doctors in America each year since it was first published in 1996. So Dr. Hendren is very well known in the United States and internationally for his work on the complementary alternative treatment in individuals with autism. And we're very happy that he was willing to participate in these webinars. And without further ado, I will present you Dr. Hendren.
Thank you, Dr. Harden. It's a pleasure to be here. It's always a pleasure to work with Dr. Harden and to work with his team of people. And it's a pleasure to be talking to you in Ukraine. I hope that there are things that we might talk about that'll be useful to you there and that you'll have access to in terms of what are sometimes called alternative treatments or sometimes called complementary treatments. But I think we'd like to refer to them more as integrative treatments in ways that we can treat autism, often using non-psychotropic medications that can be helpful. I, for my disclosures, have grants that I have mainly for clinical drug trials that are, I use the money that I'm paid to pay for my people that work on our clinical trials, and I'm on advisory boards for several companies that we're working for. Some of those companies I'll mention, and as I mention them, I'll tell you that I'm on their advisory board or doing a study for them, and also write and get royalties for these are the most recent publications. I think everybody is aware that we are seeing an increase in autism, not just in the United States, but every place. But it's easier to talk about in places where it seems to be measured more frequently and in a way that we might have better access to. These numbers really show that we are seeing more and more autism, or recognizing it more and more. And there's debate about, is it that we're recognizing it, it's always been there, or is there indeed more of it? And there are more recent figures, even than these, that show that number becoming even more frequent, according to our Center for Disease Control. We would look at this, though, and say, what could cause this increase? Could it be just recognition? Could it be, we certainly wouldn't see a genetic disorder increase like that. What other factors might be playing a role, and how could we understand better what they are? And as people have tried to look at this, they've, in a sense, divided it into saying there's a genetic neurodevelopmental vulnerability. We know autism has strongly genetic roots, that we know that that plays part of it, but we know a genetic disorder doesn't increase that way, that exponentially. So then another theory that people have talk about a second hit, that for those people that have a genetic neurodevelopmental vulnerability, there's an environmental stressor and an interaction between that. So it still might involve gene expression, but it's not solely gene expression. It's the genes interacting with the environment and affecting expression in a vulnerable individual at a vulnerable time that could then go on to develop autism. And the third is when we somehow think of autism as a hopeless disorder, that there's nothing that we can do to help it, in terms of thinking about the etiology and what can we do. Because increasingly we're recognizing that there are a number of interventions that we can make early on, especially, but throughout the life cycle, that can make a difference in how people do. And as we think about treating autism and in understanding autism, I think we might agree that it's worth considering all three of these. Any way that we can treat and do better than to treat it only as a genetic disorder, or to treat it only as an environmental stressor or interaction. So what we're going to focus on today, though, is this second hit. Is there something that we can do about the environment that makes a difference and that can help with, I don't know why that's happening, but could help with making the body more resilient, making the body stronger and more able to work. Is we think about this, you know, these multiple factors, we might think about it almost as the earth, that we think of the center of the earth, the core of the earth being the DNA, being, this is the part that is our genetics, that is affecting things. But we often are looking at the surface of the earth, the symptoms that we see. And yet there's a lot of interaction that goes on between that DNA in the center and the symptoms. It's not only those two. And yet, as we've advanced in understanding most disorders, but especially mental disorders, we've, for a while, classified them only by symptoms and treated the symptoms, or we said we're going to find the DNA to make the difference, when in fact it's all of these layers in between, the cell modulation, the messenger RNA, the physiologic processes. And to tell you just a brief story, my wife is French, and both of our daughters have married French people. And one of the guys that she married is from Alsace-Lorraine. We went to visit his family, and as we were there visiting them, going through the valley of Alsace-Lorraine, they said, would you like to visit some wineries? And I said, yeah, I think that'd be great to visit some wineries. Let's do. And as we went, they talked always about the terroir, about the soil. And they talked about how this glacier came through Alsace-Lorraine and left varying amounts of sand or clay or other lava, other things that mixed in with the soil. And they said it's that terroir, those layers, that give our wine such a distinctive and wonderful flavor. And I thought when they said that, well, you know, that's kind of how kids' brains develop. There are those layers that these things get filtered through, and that we can think of each of those layers and what we can do to strengthen it and to make it more resilient. Particularly today, we're going to talk about layer 2 and layer 3. What can we do to make that more resilient? Those things that are happening in layer 2 and layer 3 are things like immune abnormalities and inflammation. And we're increasingly finding in all medical disorders, but increasingly now in mental disorders or neurodevelopmental disorders, that we see these inflammatory processes that are going on. Also, oxidative stress or disturbed methylation or mitochondrial dysfunction. Things too like free fatty acid metabolism that may not be as strong as it might be, or excitatory inhibitory imbalance or hormonal effects, or the health of the microglia. Those are all things that we're learning. We might be able to do things that could make those more resilient, make them stronger, make them healthier, especially if we can identify what process is going on at one particular time. It's not like we could treat one of those things in everyone, or we could treat those in everyone at any time. We need a biomarker to know whether that's happening, or for some things, we can just take a chance and try some of the things that we talk about today because they're not harmful or aren't going to damage anything, but may make the body healthier. As we make interventions, if we're thinking about making a layer 4 intervention, the outside of the earth, we have behavioral interventions, family support, structure. 3 and 4, speech and language, occupational therapy, cognitive behavioral therapy. 2 and 3, pharmacotherapy. And then layer 2, the biomedical or epigenetic kinds of interventions that we're going to spend more time talking about today. We're not yet fully to the point where we can think about gene modification. And I think even if we could, people would find that controversial to think, are we doing things to modify the genes before a person's been conceived or after they're conceived, but being carried in the uterus as the body's starting to form? Would we change their genes? And there are some treatments that are thinking about that. But at least for this talk today, we're going to focus primarily on the biomedical or epigenetic, the way genes are expressing themselves, kind of ways that we might make the body more resilient or healthier. And those are often things that we find in the environment that are relatively healthy, that you can take too much, or you can have too little, or your body cannot process it well. But as we begin to suspect that that's happening, then we could think about interventions that might make a difference. There are a lot of interventions. There are probably at least 100. So I'm not going to go through all of those because most of them don't have any good evidence that they make a difference. They may have anecdotal evidence, and people may say, this made a huge difference for my child. It really worked well. But when you look for a study to show that, it's not available. And so the US Preventive Services Task Force developed a way to grade those, to say an A grade would be there's a high certainty of benefit. There are double-blind placebo-controlled trials, at least one, but usually more. And so we say that's a grade A. For a grade B, there's moderate certainty, and then so far down to even D, no benefit, or the harm outweighs the benefit, or I, the evidence is lacking or conflicting. And that's the most common category for many of these. Many of these interventions are not something that a pharmaceutical company can patent. So there's nobody paying to study those and see how they work, to have a large enough study to really know. So it doesn't mean they don't work. It just means we don't know. We haven't had the kinds of studies. So as I go through a number of treatments today, the ones mostly that I think have the most evidence of benefit or seem the most promising, then we'll talk about those grades and also a level of certainty that could be low or moderate or high in terms of how we think things might be working. So I'm going to start off with not necessarily a treatment, but thinking about how could we have the best odds for a good outcome. Many times parents come to me and to our team who have one child with autism and say, we'd like to have another child with autism, but when we understand that it has a genetic root that might be involved, or roots, because there are at least 100 genes involved, we'd like to know, is there anything that we can do to improve our odds to make it so we don't have another child with autism? So a couple of years ago, we did a search looking at Medline and different studies that talked about perinatal risk factors in autism, things like infections, medications, environmental factors, other kinds of stressors. Then we searched for interventions that may improve neurodevelopmental outcomes that included things like nutritional supplements during pregnancy, or breastfeeding, or postpartum stress reduction. Our review, which was the largest to date at that time, was in agreement with other smaller reviews that said there might be a possibility that some interventions could normalize or mitigate these processes, particularly if it was done pre-conception and parents thinking about getting pregnant, or during the perinatal period, during the time they're carrying the pregnancy or shortly after birth, and may lead to resilience in the way that we talked about at the beginning in terms of the terroir, making the terroir healthier for growing a healthy brain. We came to the conclusion that I think I've also said that there were things that might affect that. In those things that would affect the risk, things like maternal infection and inflammation, we know congenital rubella clearly results in a higher incidence of autism. So the way rubella affects the growing infant, particularly if it seems to have happened during the end of the first trimester of pregnancy, that there's a higher outcome of autism. Environmental toxicants, kids that live near coal burning plants, kids that live near where that were born where there was a lot of mercury or other kinds of environmental pollutants. Air pollution, if you live near a freeway that has a lot of diesel, there's a higher incidence of autism. Those are not necessarily cause and effect, but they're associational that say, perhaps if you're thinking about getting pregnant a second time or even a first time, it would be good to not live at the center of a freeway where big diesel trucks all converge, or to live near fields where pesticides are sprayed. People that live in those areas, like in California along the Central Valley, those people living near where they're sprayed have a higher incidence of autism and neurodevelopmental disorders. All the other things that you see listed there, including even thalidomide, which we used a number of years ago in this country to help mothers with morning sickness and with sleep disorders, wound up with kids, especially in the end of the first trimester of pregnancy, with a higher incidence of autism. There's a lot of disagreement about SSRIs. Some people say, oh, that might be a factor. And yet the more recent studies say, no, it may be related to other factors that are related to taking SSRIs, but not to SSRIs themselves. Interestingly, even acetaminophen seems to have an association with an outcome if a mother takes a lot of it during pregnancy, with an outcome of of having a neurodevelopmental disorder. Same with heavy metals, particularly mercury, but others as well. Then what could we do to help improve the pregnancy, the outcome? By what things could you take? We all know that taking folinic acid or folic acid and multivitamin supplements before and during pregnancy are associated with a better outcome that helps the neural tube close. And that's why doctors, pediatricians, OB-GYNs recommend taking folinic acid, not too much, but the right amount, in terms of helping that neural tube form in the right kind of way. But there were a number of good studies done at the Mind Institute showing a pretty clear relationship between the amount of folic acid that you took in pregnancy and an outcome of having a neurodevelopmental disorder. That was also so for omega-3s, not as strong, for vitamin D, for antioxidants, for iron, especially if the mother was iron deficient and was an older mother. Also for things like choline, were all factors. And a developmental pediatrician had a practice that was largely filled with kids with autism. And she had over 300 kids in her practice. And moms came and said, what could I do to minimize the chance that my next child is going to have autism? So she talked to them about minimizing toxicant exposure, maximizing breastfeeding, using probiotics, nutritional counseling, and it wasn't a case in gluten-free diet necessarily, it was just eating good, healthy food. She limited the use of antibiotics and minimized the use of acetaminophen. And out of her practice of 294 general pediatrics patients, in those families, those 294 families, there were no new cases of autism between 2005 and 2011 doing what she was doing. And yet we know the chance of having a sibling, if you have one sibling with autism, varies anywhere between, some people go as low as maybe 6 or 8%, but some people go up as high as 18%, saying, often depending on how close together the babies were born, saying that there is a much greater likelihood. So in this practice, she should have had some kids with autism and perhaps this kind of intervention. It wasn't a controlled study. It wasn't one that would meet the highest standards, but it would suggest to somebody, gee, I could do those things without endangering my health or the health of my baby. And maybe that'd be a good thing to try if somebody wanted to, that might make a difference in what the outcome is. So all of this leads us to begin to think about what else might be going on with autism. Autism has a number of medical disorders that are associated with it. And sometimes we've thought, no, that's not related to autism. It's just somehow related to the developmental things that they went through, but it's not connected directly. But increasingly, people are saying there are things like intestinal inflammation, a lot of GI abnormalities, changes in digestive enzymes, metabolic impairments, oxidative stress, mitochondrial dysfunction, immune problems that can all be involved with kids that have autism if we test for it or look for it or see the symptoms that they have. And improvement in their symptoms might be achieved by a combination of nutritional recommendation, prescription medications, and then addressing those underlying medical conditions seen in the individuals to see if improving their health might improve their autism. You may say, well, sure, if you have diarrhea and you're pooping all the time, that would make anybody feel more irritable and cross and not do as well. But there seems to be some sense that even treating that GI symptom, which we're increasingly recognizing has serotonin connections to the brain, seems to help with the outcome of people who have autism. So I'm going to go through first a kind of section looking at different kinds of interventions, and then looking at a few of them that seem to have the best evidence, and then talk about what that evidence is as we go along. If we're talking about things that we might use to treat autism, and there have been studies, there are all of those that you see listed up there and many more. We're not going to talk about all of those because there isn't good evidence, but it doesn't mean they don't work. It just means we don't know whether they work. So what we're going to talk about are studies that have been studied enough that we can see whether they make a difference. And so some of these studies you'll see come up again, but I'm just kind of showing you the overall list that could be even larger, that many times people that are practicing integrative medicine might be using in their practice. The ones we're going to talk the most about start with those in red that have the most evidence: melatonin, omega-3, vitamin D3 and NAC, and acetylcysteine. Those that seem to have some promise, but maybe not as much evidence, like methyl B12 and vitamin and mineral supplements. And then things that don't have enough evidence to recommend, but that there are people who anecdotally say, this is making a big difference, or there are studies that haven't yet been published, but have preliminary evidence available that would suggest they make a difference. And those are things like diet, or treating the microbiome, or pancreatic digestive enzymes, or CBD and THC we'll talk a little more about as we go through, and some about probiotics and what evidence they might have for making a difference. So first, if we talk just about immune function and inflammation, then we're talking about things like melatonin and vitamin D. You can see that melatonin has a grade B, vitamin D has a grade C, but there's moderate evidence for both. And there's enough evidence to say you might talk to patients about it, help them read the literature, decide do they want to use it or not. And we're going to talk about both of those in just a minute. There's things like for mitochondrial function that people say might make a difference, but those are things like CoQ10 or L-carnosine or carnitine. And the evidence for those is really insufficient. There are people who believe they make a big difference, and perhaps they do, but we're not going to talk more about those because there isn't enough evidence for us to examine and say whether they do or whether they don't. But family members or their practitioner that they're working with may still decide that they'd like to do this, or someday there may be enough studies that indicate this makes a difference and someone might be trying it. So for melatonin, there have been several large reviews, the biggest one done by Dr. Rosignol, but other reviews that say that melatonin seems to make a difference in helping kids sleep who have autism. There's been some controversy about whether melatonin helps kids sleep in general, all kids. But it does seem like it makes a difference for kids that have a disruption in their sleep cycle, which many times kids with autism do. And so studies that have looked at sleep cycle before and after treating with melatonin have said it makes a difference. The part that hasn't worked for some people is regular melatonin generally lasts 3 or 4 hours. And your body releases melatonin when you're getting ready to fall asleep, and it has a big peak, and then it goes down slowly over the rest of the night. But taking regular melatonin doesn't do that. So there have been preparations developed that have a regular big peak and then go down slowly, trying to imitate what the body does with melatonin. And it does seem to help kids sleep through the night better. The big burst of melatonin may help them sleep in the first 3 or 4 hours, and then they wake. But the one that wears off slowly may help for both the initiation of sleep and the maintenance of sleep. So the other part that has some controversy is how much can you give? But the studies, for the most part, have looked at anywhere between 2 and 10 milligrams a day. And sometimes people will stop at 2 or 2.5 or 3. And yet many times kids do better at 10. Some parents go way above that. And for the most part, there isn't good evidence that it's okay to go above that. and that it may make kids groggy the next day and not do as well. But those dosing ranges seem to work okay without detrimental effects. And we're talking here about kids with neurodevelopmental disorders. Vitamin D doesn't have as strong an evidence, but it does have evidence that says it makes a difference. And it makes a difference, especially for what might be 57% of kids with autism who have vitamin D deficiency. In general, a lot of kids have vitamin D deficiency, but kids with autism seem to have a higher, somewhere in that range between 30 and 60% when you look at their vitamin D levels, and then supplementing those kids with anywhere between usually 1,000 and 5,000, depending on how aggressive you want to be at the beginning, and not necessarily continue at the 5,000, but start at 5,000 at the beginning for kids that are really low in vitamin D. This seems to be especially a problem for people who live in areas where there's not a lot of sunshine. They don't get out in this, the kids don't get out, or for kids with autism that spend a lot of time in the house looking at video games or looking at television and don't get out and get sunshine. So thinking about vitamin D as a supplement has been shown to be of a modest amount of benefit, not a large benefit, but a little bit of benefit without real risks unless one goes to way too high of a dose. Mitochondrial dysfunction, I had mentioned before, said we weren't going to talk much about it, but there does seem to be, when we think about mitochondrial disorders, those are fairly rare disorders, and they often involve muscle weakness and others, and you need to do a muscle biopsy. But people have found evidence of mitochondrial dysfunction. It's not working quite as well in people with Down syndrome, Rett syndrome, autism, and Fragile X. So those mitochondria that are the little energy bunnies that drive the cell are not functioning as fully as they might. One study said in a randomized control trial with 78 kids that CoQ10 improved the outcome, and the outcome was what's called the Global Impression Parental Questionnaire, which isn't people's best. It's kind of a parent saying, I think my kid is better, but they did report some improvements in sleep and GI problems. And you'll find parents that say, yep, CoQ10 has made a difference for my kid, but I don't think that's enough to routinely recommend it. Kind of moving into a new category, we're going to talk about oxidative stress and then mention, but not talk about neurotransmitter production. For oxidative stress, there are things like curcumin, the taste that goes into Indian food. It's also called turmeric. And both of those, the evidence is kind of insufficient at this point, but there have been other studies, smaller studies, that are suggesting maybe it makes a difference. Maybe it improves oxidative stress. Also for glutathione, maybe that improves. We did 2 studies of methyl B12 that's given as an injection underneath the skin with a very small needle, like a TB, the way you give a TB way of determining whether somebody has tuberculosis. That this has 2 randomized controlled trials, but that's all, just 2. So it still gets a grade C. It's something that might be considered. I do find some parents find it's made a difference for their kid. And in the studies that I did, I was the rater. I felt it made a difference, but there hasn't been enough replication to really say with great confidence that it's going to make a difference. N-acetylcysteine, Dr. Harden did one of the very first studies of NAC. We're going to talk a little more about that and talk about his study that suggested for some kids, it made a difference. And the studies that have come after that have either been positive or have been equivocal. It's not clear whether it makes a difference. So in general, that gets a grade B with moderate evidence. and is especially helpful for people that might have repetitive or self-injurious behaviors, and we'll talk a little more. And then sulforaphane, which is a concentrated broccoli sprout extract, but you'd have to eat an awful lot of broccoli to get enough of it, but it does come in a pill. And there are some studies. We did one study using metabolomics, which was a way of looking at biomarkers, showing that kids that had abnormal biomarkers before and showed the most improvement in the biomarker also showed improvement in their behavior. But there have been other studies that have been negative. So it gets a grade C, and we'll talk just a little more about it as we go along. And as I think Dr. Harden pointed out at the beginning, we'll have time for questions and comments from people. So if you have them and you haven't already asked them, then be sure and write them down. So I know I'm going through a lot of material pretty quickly, but if we passed over something that you wish we would have spent a little longer on, then let's come back to it. So in the methyl B12 study that we did, and as I mentioned, we did 2 of them, but this one that's reported here was the better one because it wasn't a crossover design. It was a regular randomized control trial. And they would get a high dose of methyl B12 given sub-Q underneath the skin every 3 days. The primary outcome was the CGI improvement, which, as I mentioned before, isn't necessarily people's favorite outcome measure, but it is, if someone is an experienced rater, often the thing that shows the most change, because there is sometimes just something that you notice that's different, that it's hard to say what it is. The second child that came into our study, when I was the head of a place called the Mind Institute that's at UC Davis, and when the parents who raised $100 million to build this place and develop it hired me at the very beginning, they said, we want you to leave no stone unturned about what might cause autism. Do good science, but keep an open mind. So I brought a group of people together that were interesting, not necessarily main path researchers. And I said, what should we study? And the first thing they asked was to study chelation. I said, you know, I'm not going to try chelation. That's so complicated, pulls out lots of heavy metals. You have to replace the heavy metals. It's you have to clean the gut ahead of time. What's next? And they said, well, what about methyl B12? I said, okay. I'd never used it. I'd never thought of using it. I didn't know that I think it would work, thought it would work, but we went ahead and did a randomized trial. The second kid that came into the study had pretty severe autism. And he was a kid that just seemed kind of not connected. He just wasn't there. He was really in his own world. And after being on the methyl B12 for about 4 weeks, he came in with his parents, and he seemed different. He looked at me. He seemed aware of who I was. And I looked at him and he looked back. And I said to his parents, do you think he's different? And they both almost had tears in their eyes. They did have tears in their eyes. And they said, oh, we think he's different. He's connected to us now in a way that we've never seen. It was like a veil had been lifted. This autism veil that was making him ill had been raised enough that some of him could get out and they could hug some of it and pull it out. Now, it didn't cure his autism, and he took it for a couple of years and then stopped. And he was better, but he wasn't over autism. But there was a sense that there was something not totally healthy with his body, that this helped make healthier and helped him then grow and develop in a way that was moving along. So we found other studies that did the same, and I still think that metaphor is helpful in thinking about what sometimes these integrative medicine or biomedical approaches can do to help people do better. And we also found that the ways that we measured different kinds of biomarkers showed changes that correlated with improvements. NAC, and this is a study by Dr. Harden, looked at N-acetylcysteine as a glutamate modulator. It's used sometimes to treat Tylenol overdose in the emergency room, but there was some thought that perhaps it could help with repetitive stereotype behaviors or things like skin picking, other kinds of harmful types of things. And as I say, the number of studies, I can't remember, I don't have that up next, but there are a number of other studies, some that replicated this, some that didn't. I use it a fair amount for kids with that. I'd say in my practice, maybe half seem to do better and another half don't. And you titrate up. The way Dr. Harden did is the way I do, is starting at 600 for a week, then 600 twice a day, then for a week, then 1200, 600 for a week, then 1200, 1200. And by the time you get to 2400, if it's not making a difference, it's probably not. So that's the way, at least, we found benefit. But his paper is published and you can see it, and there are several others as well. So Sulforaphane is the one that I mentioned, was the concentrated broccoli sprout extract. We did a study at a school for kids who have autism that's just outside San Francisco, where we're located. And it was a 12-week study using metabolomics as a biomarker of outcomes. And we found that kids improved, not all of them. Those that had the most abnormalities in terms of their aberrant behavior checklist and their social responsiveness scale were the ones that showed the most improvement. And that group also showed improvement in the urinary metabolites that measured oxidative stress, amino acid and gut, the microbiome, neurotransmitters, hormones, and then interestingly, sphingomyelin, which is involved in white matter, which may play a role in autism as well, but that seemed to help. Again, that hasn't been replicated. It's hard to recommend it. There are some studies that have come from different places in the world saying that sulforaphane helps. There have been a few others saying maybe it doesn't. So I think it probably helps for some kids, and we don't know who they are. If we take every kid with autism, and I know you've all heard this expression or saying about, you've seen one kid with autism, you've seen one kid with autism. There are lots of variations on autism, even though at the end we can say, that's autism. There's different pathways that one gets there, and we need to find how to treat those pathways in order to effectively treat kids, rather than using the same thing to treat all kids that have autism. We're getting kind of a little over the, well over the halfway point, but looking at things that are just vitamins, things like omega-3s, folinic acid, we've talked about already, and vitamin D. There are a variety of others, and you'll see most of those have insufficient evidence for whether they make a difference. But there are people that feel strongly that it makes a difference. For instance, magnesium seems to be helpful for sleep disorders. And there's a growing number of small studies suggesting that magnesium helps for sleep. There are also studies, but insufficient evidence for ascorbic acid, zinc and copper, and inositol. The omega-3 fatty acids seems to make a difference in most studies, but a modest difference. It's very small. We did a study where we did it as a nationwide study that we recruited a fairly good number of people and then mailed them either the omega-3 or placebo, and showed that the active separated from placebo. There are several other studies showing that it makes a modest difference, not a huge difference, but it does help with brain growth and development, and and helps improve polyunsaturated fatty acids, which are involved in brain growth and development and are sometimes not as high as they might be for children and adolescents with neurodevelopmental disorders. Folinic acid has been studied, especially by Richard Fry, showing an improvement in language for kids with autism. Based on this study and a couple others that he did, he has a multi-site grant from three well-known institutions around the country looking at folinic acid for treating kids with autism and language impairment. That study, the results haven't been released, so it's not clear whether that large study is showing a difference. But in his study with 44 children that these were based on, it showed improvement, or his 48, and then the next one by a son, 44 children, all showing that they improved symptoms in sociability, cognitive and verbal expression, receptive language, and affective expression. Then if we look at the microbiome, there's studies looking at probiotics and pancreatic digestive enzymes. Both of them don't have enough evidence at this point to say we should use them, but whenever I have a child that has autism and has a lot of GI abnormalities, I send them to see the GI specialist, and he puts them on probiotics and pancreatic digestive enzymes. And I think, well, I could do that without sending them to the GI specialist. And so I do, and I find some kids do better. And there are studies we'll talk briefly about in a minute of both of those things that might suggest making a difference, especially for kids that have GI abnormalities, but for some kids that even don't, but maybe still make some difference in their GI health. The one looking at the microbiome, we know that there is some GI barrier defects, alterations in mouse models that have shown this. One study that was done looking at using what's called they cleanse the gut and then put in sterilized feces from someone who's healthy, implant it in the gut, and then help it grow back healthier. That's the last study listed there. It's called microbiota transfer therapy, and has shown a difference. And there have been a few follow-up studies that are referenced there showing that it has indeed made a difference, but it's still not something that people would say, well, we should be using this for everybody. The study that was above that, talking about what about mouse models, there was a group at Caltech that looked at they created a mouse model of autism and then treated it with this mouse model with Bacteroides fragilis, which is a kind of probiotic, and actually got rid of the autism. The autism in a mouse didn't come out looking the same, or they didn't seem to have it anymore, suggesting maybe there are ways that we could treat the gut in autism that could make a difference in even how autism expresses itself. And this MTT study also suggests that as well. Then there is a study that's looked at autism and GI symptoms that uses a kind of thing that the kids take that coats the large proteins in the gut and helps decrease gut inflammation. It's a strong study showing that it made a difference in Australia and New Zealand, but that's now this company, Axial, is doing studies here in the US that are showing improvements. You can get into those studies, and they're in a few other countries as well, by going to that video link that'll tell you more about the company and more about what they're doing to show that this seems to make a difference for autism by treating the GI tract. Pancreatic digestive enzymes, I mentioned that was something that GI specialists would recommend to me. But there's a study called CureMark that has looked at pancreatic digestive enzymes. It hasn't been published yet. Parts of it has. It has been completed, and hopefully it'll be published soon. But it uses a biomarker of fecal chymotrypsin, and has published that, saying that these kids that did the best showed improvement in their fecal chymotrypsin with pancreatic digestive enzymes, and suggesting that these kids have trouble digesting large proteins that then go through the gut and cause inflammation in the gut, that then leak the products in the gut that then affect the way the brain works and functions. So hopefully that study will be published soon. Also, there are a variety of other things, and I won't go into this in as much detail, but just for the sake of inclusiveness, I'll talk about a few. And I'm on the last 4 or 5 of my slides, and then we'll move on to talk questions and answers. So GABA aminobutyric acid, has shown some benefit. There aren't any studies worth reporting, except to say that there are studies that suggest that there's a benefit, but not randomized controlled trials that we could say, yes, this really works. Vitamin and mineral supplements, relatively high doses of some of these, including even lithium, have shown some improvement, but still grade C, insufficient, but some doctors consider it and find it helpful. There was a randomized controlled trial of acupuncture that looked at a systematic review of those that was published recently, and another one that was published even more recently, showing that for some children, acupuncture made a difference. But the conclusion of these systemic reviews and meta-analyses was there's not sufficient evidence to recommend acupuncture routinely, but the people who are doing the acupuncture are feeling like it makes a large difference, and the people who did the study thought that it was certainly worth considering. Medical marijuana, at least in this country, as marijuana became more and more available, people were using CBD or CBD with THC. And there's now one large company that's doing a number of trials of CBD, some with a little bit of THC in it, that is moving along, and they're doing one study with adolescents and starting a study with adults and starting a study with younger kids, showing that the endocannabinoid system may be playing a role in the social reward system, and that treating with CBD and maybe CBD with THC results in improvement in how kids are doing, and it's thought maybe there are neuroprotective and anti-inflammatory effects, especially through the microglia. The evidence, again, isn't totally overwhelming, and there are the risks of things like, does it affect memory? Does it affect other things? So using it for a child that may have serious autism and a lot of aggression or anxiety may say, well, it's worth it, but what about other people that don't have autism and don't have those factors? So I don't think we know yet, and we need more studies to know more. But I have a number of patients that are taking cannabidiol. They can get it at a dispensary in California. But even at the beginning, I used to prescribe it for some kids when all the psychotropic meds I could try weren't helping them with their aggression and their meltdowns and a variety of other things. And while cannabidiol didn't cure it, it helped make it better. And so it's something I think a lot of parents are considering, and there's a growing body of evidence that will hopefully help us know more about it soon. The other thing that I'd say in closing in the study is that there's a suggestion that early onset dementia may happen in adults with autism spectrum disorder. We know that happens in kids with Down syndrome. There's this one study that's controversial. It was published in 21 that suggested that as they tracked kids with autism into adulthood and then into older age, they developed dementia at an age earlier than their matched cohort of same-aged people. So it raises the question of saying, is there anything we can do to help? I don't know of what we can do to help with dementia at this point, but there are things like a variety of different supplements, and Dr. Berenson, who is a good researcher and has a strong background, has a product called NeuroQ that he says helps people with dementia, but it's not a randomized controlled trial. But he has published it, but again, a pilot project. You wonder, is there anything that we could do to help kids with autism from developing dementia early in life? I'm not going to go through this, but I hope that you have access to my slides, because there are a number of KIM therapies, integrative medicine therapies, that can be used to treat insomnia and to treat anxiety. So you can see other things other than what we just talked about that don't have evidence, enough evidence to recommend, clearly, but like valerian root, St. John's wort, kava, passion flower, GABA, 5-HTP. We've talked about some of these in Calm, the one with magnesium. And then I think this is near my last slide. Thinking about transcranial magnetic stimulation has been shown to have some benefit. I don't think the verdict is in yet, but I heard 2 studies presented in the last month that suggested there was some benefit. Psilocybin, there was one case study of someone with showing some benefit with autism, but also another case study with mania showing that the psilocybin didn't turn out well. Ketamine, some people think it might make a difference, stem cell, but I think all of these are too early to tell or to say anything definitively at that point. There are studies that talk about the benefit of music therapy, horse therapy, massage therapy, herbal medicine, yoga, and then I've mentioned transcranial direct current stimulation, all of which have reports, but don't really have good randomized controlled trials. So I'd say in conclusion that the ones that have the most published evidence to think about and to perhaps recommend include things like melatonin, omega-3, vitamin D, and NAC. And those with some evidence for maybe making a difference, or methyl B12, sulforaphane, and folinic acid. For families that are interested in trying them, I do try and be sure that they see somebody who knows what they're doing when they're doing that and that can dose effectively, and to think about how to do that. And again, it doesn't mean that those things that I'm not endorsing means they're not effective. It just means they haven't been studied enough. So I used the metaphor before, but I hope that as we think about how to make kids healthier, how to make their body more resilient, how to make their epigenetic expression better, that we can begin to lift the veil of autism, like that one patient that I described, where you could see his eyes clear up and he looked out more and he connected, that we can lift that veil to help people with autism maybe retain some of the things about autism that are good, that people like. There are certain ways of connecting or understanding the world, or a sense of humor, or a variety of other things that people say are a good part of autism, and let's not get rid of that. But the impairing part, it would be good if we could improve as much as possible. So we're thinking about medical treatments, ancillary treatments, behavioral associated symptoms, and then the biomedical assessments. But what's really most important, what's all encompassing, is building personal relationships and resilience, which is the key to the best kind of an outcome. At the Mind Institute, when it was first being built, we did a call for art all over the world, actually, and people submitted things from people that had neurodevelopmental disorders, and then we had a juried art show pick out the things that would hang, and there were 80 pieces that hung in the Mind Institute. This is one of them, and it's one of my favorites. It's called The Haircut. You can see the way this boy feels about getting a haircut by the expression on his face. You can see what's likely, this boy drew this picture, and he was about 4 at the time. The boy is now in his late 20s. I still see him. He still has autism. And he stopped drawing for a while, but it started again. But in this one, he showed the barber, and the B is probably the buzz of a razor cutting the hair. And then you can see this door in over here. And he always, his mom said that he always showed an escape route from an uncomfortable situation, a way to get out. And I hope that as we think about building resilience, building epigenetic health and ways that gene express themselves in the best way and interact with the environment in the best way, that we can give an escape route for boys like this and for others that have autism. So I see Antonio is there, and I'm ready for discussion or questions or comments.
Very. Thank you, Bob. This is very informative, very comprehensive. I want to thank you first for doing this presentation for us, but more importantly, I want to thank you for all your body of work in this area. Like you mentioned, there is maybe over 100 potential intervention. Actually, we did a tally one time, and we identify over 1,000. And
Wow.
your focus on trying to develop the evidence, identify the evidence, and do the studies in this field is so critical and so helpful for families, not only in the United States, but across the world. You know, something that we've observed with our families is that most of the time, the parents are giving some supplements to their kids. It's not if, it's what they are taking. And that's why we always ask about the different supplements. As you mentioned, some of them might be helpful, but the jury is still out, which means that the evidence is not there. And I think the hope is that there will be more science over time that will allow us to move one from a D to a C to a B, and hopefully one day soon to an A, because there is nothing like a supplement that could make a difference because of, in general, their tolerability and the minimal side effects. So thank you.
Thank you.
So we have a lot of questions, as you would expect. This is a very popular topic. The first one is, since you mentioned about, you know, in fetal development, how, there is a question in terms of how can we screen a fetus during pregnancy to be sure that the child does not have autism?
You know, I don't know that I have a good answer to that. I think there are people that are beginning to say they can find things in the amniotic fluid, that they could find other risk factors, but I don't think any of them could lead to saying, oh, this child's going to have autism, or I think that we should. I've had some families consult with me about all their risk factors and then wondering about whether they should abort. And I just said, you know, I don't know how to guide you in that decision. I don't know if you have any advice, Dr. Harden.
Yeah, so, you know, this is a very tricky and sensitive area because of the risk of that, you know, some people would feel that identifying in utero a child with autism, or a baby with autism, or a fetus with autism, that parents might prematurely or without enough evidence move toward the abortion. So that's why it's a little bit sensitive. There have been, I recall one study that was conducted by Janet Lanehart when they looked at the using sonograms, trying to see a little bit the brain size of the fetus, trying to see whether that will predict autism. But as you expect, it's only one study, and I don't think there were clear benefits or clear conclusions from it. The other thing that we probably get consulted on is that parents of kids with autism planning whether or not to have a second baby or a third child. And that's where sometimes I've had this question clinically. And like you mentioned, we discussed the risk of having a second child and sometimes a third child And I've had that with families who had 2 children with autism, and they're considering having another child. So unfortunately, we don't have clear answers about that. And it's, hopefully with time, we'll have more science to support this information. Okay, next question is that how can hydrocephalus affect the development of autism or the development of the brain in individuals with autism?
I don't know the answer to that. I don't know if you do, but I've not seen a study or been aware of anything that connects hydrocephalus and autism.
Yeah, I think I don't think there is a clear link, but having hydrocephalus might increase the risk for neurodevelopmental disorders, learning disabilities, ADHD, and definitely disabilities, including autism. But I'm not aware of any study that's linked it directly. Okay. The question about war trauma and COVID, how that could have affected the growth, the emotional growth of children in general and children with autism specifically.
Yeah, I think that's really an important question or thing to consider. I think the way I don't know as much about war trauma, but can imagine, and then thinking about with COVID, the way young people have been in some ways not able to get into the treatment that they need. They've been kept home. They've not learned socialization skills. They've not had the opportunity to benefit from interventions that we know can make a big difference. Has really, I think, put some kids back. I consult regularly at a school for kids with autism, and fortunately, it was only about 3 or 4 months that they were not going to school. But I have a lot of families whose kids weren't able to go to school, and they felt their kids didn't grow and may have even regressed and didn't keep learning social skills and other things. So I think that makes a big difference. And the war trauma that would keep kids from being able to go to school, or their school maybe isn't even there any longer. All of those things I think we're going to see big effects, not just for kids with autism, but I'm afraid that it's happening for all kids, maybe more for kids with autism. But I see lots of teachers and parents and others telling me how concerned they are that kids have really lost skills or not acquired skills during the time that they were quarantined.
Thank you. A question about the diet, the non-gluten, non-casein diet. Your thoughts and the evidence to date.
Yeah, that's really a good question. I would say that there hasn't been a good study showing that the casein gluten-free diet works. And people have tried, but it's a really hard study to do, because how do you create a placebo that's like a casein gluten-free diet to have people not know whether they're on a casein gluten-free diet? We tried to do that at the Mind Institute, and the kids could tell. They knew whether it had casein gluten or whether it didn't. And so people have tried and then usually prematurely terminated the studies. I would say, though, that I've had some parents that I believe religiously followed the casein gluten-free diet. They did it for at least 6 months. They really worked hard at it, and they said, it didn't make any difference for my kid. I have other parents that tell me they religiously followed it, and it made a big difference. They would say it's the single most important thing that they've done in terms of treating their kids. And I don't feel like these parents were easily influenced or misled. I think there was something that maybe someday we'll understand why some kids are sensitive and some kids are not, and we'll know better how to do that. I tell parents, if you're going to do it, it's very hard to do. You need to appreciate that. To follow that, everybody in the family should follow it, because you just can't have casein and gluten around the house and the kid doesn't get to eat it, but everybody else does. So everybody needs to follow it. Then you need to worry, what if the kid's going to a party, or what if you go out, or all the other places? Where do you get food for them? And what does that do to their socialization if they can't go to a birthday party because they might be eating cake or other things? So I think parents have to consider that, but if it fits with their way of doing things, maybe it works. I'm hopeful that there are 2 or 3 studies that we're doing now that may affect, that companies are doing, that we're doing for them, that may affect what's happening in the gut with casein and gluten, that they're large proteins. They don't get broken down by these kids' guts for some reason. That large protein irritates the lining of the gut, and that makes the gut more not as healthy in the way that it's working. And that's at least the idea behind these studies. And maybe somebody will find a way that does what the casein gluten-free diet does without trying to have it just be with diet.
Very good. Thank you. There was a translated question about the NAMCHEck protocol. Are you familiar with it? And what's the evidence base supporting the evidence base about it?
I am familiar with it only by having gone to the website and looked at what the website says and what it says about the doctor that's doing it and the results that are reported, but I've not seen that reported in a peer-reviewed literature or refereed literature. And I've not had any patients that have been involved with it long enough to have it work. So I don't know. Do you?
No, I'm actually, as you were talking and I saw this, doing the presentation and I saw this question, I went and I checked the web, and it looks like there is a book by Dr. Namchek, I think, who's, marketed a little bit his approach. It's in the book. So that's why maybe there are no papers, but it's based on a book that they wrote.
Yeah.
Very good. Another translated question. What kind of food autistic kids should avoid? I
don't know of any foods that I'd say is going to make their autism worse, but I think the thing that is concerning is that many times kids with autism, it's fried food, it's chicken McNuggets, and that I don't know if you still have active McDonald's in Ukraine, but these kids, I have some parents that spoil their kids so much that's all they feed them. And then their triglycerides get out of whack and a bunch of other things get not doing so well. So I think there's ways that you can ruin the kids' health by feeding them things that they like that are not necessarily healthy foods. I think there is a good evidence that eating healthy foods that are kind of like the popular Mediterranean diets or other things like that now that are not high in fat, not high in carbs, are helpful, but it's not clear that that's more helpful for autism than just being helpful for their health.
Yeah. Very good. Thank you. A question about potential side effect of treating a child with vitamin B12.
In our studies, we didn't find any significant side effects from any of the kids. And I think we did about 100 kids. And the people that I know who use it a lot tell me they don't find side effects. But some people describe an increased mouthing, that for some reason kids put things in their mouth more often, but that doesn't seem to continue or create problems. You can go too high on the vitamin B12, and there was a good endocrinologist at Baylor that was concerned about people going way above these normal values. But I can't tell you that I even remember what he said were the side effects that he was concerned about happening. Sometimes people will think, oh, if a little bit's good, maybe I should use a lot. And I wouldn't suggest that. But for the doses that we used, which were considered high doses, we didn't find any side effects.
Okay. Thank you. A question, since you mentioned dementia, a
Oh,
question about Lewy body dementia. I don't know if you recall, I don't know if you've seen a case like that. So the question is prevalence of Lewy body dementia among families of kids on the spectrum or kids with autism, and something linked whether there have been any genetic study linking ASD, Lewy body dementia, and ADHD.
yeah, I don't know of any studies about
Yeah.
that. It's kind of what's hard for those of us that are child psychiatrists, even though we're seeing now these people age, we haven't spent as much time working with people with Lewy body dementia or other dementias.
Yeah, and Lewy body dementia is very, very rare. So you will be lucky to, like, during our training to have seen one. So, okay. Have you seen any cases, children with AD who completely improve with intervention or medication, and they don't show any features of ASD?
I've seen some kids get a lot better, and they maybe don't have the diagnosis of autism any longer. So they've moved off the spectrum, but it's like all of us in our personality. It's not, we're not going to change that totally. If you find somebody that has OCD and they get better, they're still a bit OCD. Or if somebody is still was a little bit, well, anyway, you get the, I don't think that, I've never seen somebody become transformed. And part of it is the time that they were autistic, they missed learning certain things that might have helped them in interactive ways or other things that they missed a certain part of development. But I think some of it is just the way their brain's wired.
Yeah, there are some studies actually that looked at kids who over time improved significantly to the point that they don't meet the diagnostic criteria of ASD, but it does not mean they are neurotypical. So they will continue to have some difficulties, whether are learning difficulties, some mild social difficulties, but the severity of these symptoms is not significant to warrant the diagnosis of ASD. Very good. I think, as you would expect, a lot of questions will, just because we would like to end a little bit in 4 minutes, maybe we'll take 2 more questions. What intervention you consider dangerous? Or how do you coach parents about complementary and integrative medication or treatment with regard to monitoring dangerousness?
I encourage parents to read the literature with me. I tell them how to use PubMed. I tell them to look at those articles, not look at Google, but look at published studies. I think chelation in the hands of somebody that doesn't know what they're doing can be dangerous. So one kid died from somebody using an improper chelator. It wasn't chelation necessarily, it was the person doing it didn't use the right chelator and the kid died. So now people say, well, chelation leads to death. I don't know that chelation leads to improvement in autism, but I don't know that it leads to death, at least when I've seen a number of kids get chelated and do okay. The IVIG, sometimes people are concerned about what can happen if somebody's using it and they don't know what they're doing. And yet I have seen some kids with autism, particular kinds of autism, get a little better from IVIG. I don't think we know well who those are. I don't, obviously there are, punitive, negative kinds of interventions. There was a school in the Northeast that used to shock kids that had autism, use a cattle prod to have them stop doing things. I think that's really dangerous, anything that, hurts these kids. But I don't know of any of the integrative medicine things unless it's being used at way beyond recommended doses that I think are dangerous.
Very good. We'll take 2 questions. One about because I saw it by 2 people. is regarding oxygen treatment, hyperbaric oxygen chamber treatment. It was popular maybe 10 years ago. Any thoughts about it?
Yeah, we did a study when I was at the Mine Institute of HBOT, and it didn't seem to make any difference.
Okay.
It takes a while to do. It's expensive. The people that were supporting us in doing that study believed that it had made a difference, but some of the studies that have been reporting differences didn't have a randomized control population. Some even used their own children and reported benefits. So I think the studies are questionable. There are still people that feel like it makes a difference, and perhaps there's a subgroup of kids that we don't know that would benefit from. HBOT does seem to work for people that have brain injury.
Yeah.
So maybe there is some group that it works for, but I don't think as a routine treatment it's worth doing.
Very good. Thank you. I left the last question that hopefully will bring hope to some people. What are the 2-3 different compound medications, supplements that you're most hopeful about? Like if you, I know you're transitioning to retirement, but like if you give you like 20 more years or 10 more years, or recommendation for new investigators or investigators who feel into the things that you would see potential hope for them.
I don't know that we have anything that is going to bring about a cure yet. Some of the transcranial magnetic stimulation stuff seems hopeful, but it's like so many things that start out when there is not much of it, and somebody reports anecdotally that it makes a difference. So I don't know. If I was going to say of what we talked about today, what would I try for my kid, or what would I feel hopeful with? I think methyl B12 really made a difference for some kids. I think folinic acid has made a difference for some kids. I think the other things are less, and I don't think we know enough about what those other things are that might be helping certain people. But I think things that maybe increased myelination or the health of myelination. I don't know what exactly that would be, but I think there are some of those things. I think I appreciated so much what the parents told me when they were interviewing me to be the executive director at the Mine Institute, which was, you know, leave no stone unturned, do good science, keep an open mind. I hope we keep doing that and try to be open to whatever somebody thinks might be helpful, and say, how could that work? You know, what's the mechanism? How can we study that more? How could I work my way into it? I feel hopeful that metabolomics will sometime be able to give us a profile for a kid so that we can better tailor treatment rather than just shotgunning it. And I think that'll make a difference.
Very good. Thank you. Big thank you.
Thank you. It's nice to work with you on this one again. And I hope that the people who watch it get something from it.
Yeah, thank you. And I want to thank all the people who are in attendance. I know people in Ukraine are going through difficult times now recently.
Yeah.
The good thing is that this is going to be available for anyone who will be interested in watching again. It will be in English, Russian, and Ukrainian. Thank you, everyone, for making this happen. And thanks again, Bob. Hopefully
Thank
to
you.
see you soon.
Nice to see you, Antonio. I hope we stay in
Okay.
touch. Bye.
Yes. Bye-bye.